the new year might have you pondering what you can do to look better, but on a budget.
Gail Anderson begins her new year, new you, get a job January. A nice series of reports. Check it out.
These legs belong to Julie Janney, who was not very happy with them. No?
No, I wasn't. I had all kinds of little spider veins on them for years, and I had never done anything about them until my dermatologist recommended Dr. Duffy. So I decided to come and get rid of them.
Now, I think part of the problem, Dr. Duffy, is that few of us knew you could do anything short of surgery.
This has been around forever. Sometime in the early 30s, a fellow did it, made his own needles, and it has waxed and waned in popularity, but it is the most effective way to treat them. The lasers don't work as well and hurt more and cost more. So this is really a good procedure, but it takes a little skill to do it. You have to learn how to do it.
And you are using that skill on not just legs, but hands. Let us show you. Here's another patient. This is Betty Herman, who decided, she told us her hands looked like her grandmother's hands, and she was done with that.
We do them the same way, but they're larger, so you use a stronger solution. Then put a dressing on them after. That's been a very successful process. The real problem with it is, again, it takes several treatments, and also they have a little trapped blood in these larger veins, so you have to drain them.
And with Julie's legs, we have a photograph here of the before picture. The transformation has been dramatic.
Yeah. Vessels of this size often go away or almost completely go away in one treatment.
What?
Yeah, and the reason they do is that they're suddenly destroyed. Nobody knows exactly why. This is an intrinsic response, whereas the little tiny red ones, particularly those that come on after treatment, are much more difficult to treat. More treatments more slowly.
And what is the solution you're using here?
This is called Esclera. It is a type of solution that was approved in Europe many years ago, was finally approved in America. It's very safe, very simple to use. It doesn't hurt. And we're grateful to have it.
Julie, what do you think?
I think it's great.
Did it hurt any? You know, people worry about needles.
No, it was just like a little sting, and it's really worth it.
Now, the photograph we showed was 6 months ago. This is where you are 6 months later.
This is amazing. I actually never thought this would ever happen, because I'm amazed, and I'm prouder to go bare-legged in the summer.
Now, she needs to have some follow-up care here. What should she be doing on her own?
Well, first we put them into compression hosiery, which seems to press the walls of the veins together and make it work better. Okay. She wears those overnight, a couple of nights anyway, does a lot of walking. And then other than that, other than not doing high-impact aerobics or something that makes the legs jump around a lot, that's about all she needs to do.
Congratulations, Julie.
Thank you. Thank you.
Back to you in the studio.